If you're a man over 60 and you've noticed changes in your energy, strength, or overall vitality that have you wondering if this is just part of getting older, I want you to stop right there. Because what I'm about to share with you today challenges everything most men have been told about aging. Hi, I'm Dr. Margaret Jimmy, and in my 25 years as a physician specializing in men's health, I've seen thousands of men who came to me convinced that decline was inevitable. They'd been told by well-meaning friends, family, even some healthcare providers that feeling tired, weak, or less vibrant was just their new normal. But here's what most people don't realize. While aging is natural, dramatic decline is not. The difference between men who thrive after 60 and those who struggle often comes down to understanding how the male body actually works and what it needs to maintain optimal function throughout life. Today, I'm going to share with you the science-backed strategies that can help you reclaim your vitality, improve your energy, and feel more like yourself again. And I want you to know you're not broken, you're not too old, and it's not too late. Before we dive into this life-changing information, hit that subscribe button and the notification bell. This channel is dedicated to giving men like you the real evidence-based health information you deserve. Let's start with the truth about what happens to the male body after 60. I want to be clear about something from the beginning. Aging does bring changes. That's completely normal and expected. But the key is understanding which changes are natural and which ones signal that your body needs more support. Think of your body like a high-performance vehicle. After years of faithful service, certain systems need more attention, better fuel, and sometimes a tune-up to keep running smoothly. This doesn't mean the vehicle is broken. It means it's time to be more intentional about maintenance. For men, the most significant age-related changes happen in several key areas. First, there's hormonal shift. Testosterone levels naturally decline by about 1 to 2% per year after age 30. By 60, many men are dealing with significantly lower levels than they had in their prime. Second, cardiovascular health becomes increasingly important. Your heart and blood vessels have been working hard for decades. The elasticity of blood vessels naturally decreases, and circulation can become less efficient. Third, muscle mass and bone density begin to decline more rapidly. This process, called sarcopenia, can lead to weakness, reduced mobility, and increased risk of falls and fractures. Fourth, sleep patterns often change, becoming lighter and more fragmented, which affects recovery and hormone production. But here's the crucial point I want you to understand. While these changes are common, they're not inevitable in their severity. The men I see who are thriving in their 60s, 70s, and beyond have learned to work with their changing physiology, not against it. Before we talk about specific strategies, you need to understand the foundation of male vitality. Think of it as a 4-pillar system: circulation, hormones, nervous system function, and cellular energy production. Let me break this down in simple terms. Your circulatory system is like the highway system of your body. It delivers oxygen, nutrients, and hormones to every cell and tissue. When circulation is compromised, everything else suffers. Your hormonal system is the command center, sending chemical messages that regulate energy, mood, muscle growth, fat storage, and yes, sexual function. Testosterone is just one player in this complex orchestra, but it's a crucial one. Your nervous system is the electrical grid. It controls muscle function, coordination, reflexes, and the communication between your brain and body. Finally, your cellular energy production happens in tiny powerhouses called mitochondria. These determine how much energy you have available for everything from thinking clearly to physical activity. When all 4 systems are functioning well, men report feeling energetic, mentally sharp, physically strong, and emotionally balanced. When one or more systems are struggling, that's when you start experiencing what many men incorrectly assume is just normal aging. The beautiful thing about the human body is that it's remarkably responsive to the right inputs, even later in life. Studies consistently show that men in their 60s, 70s, and 80s can make significant improvements in strength, energy, and overall health when they provide their bodies with what they need. Let's dive deeper into circulation, because this is where many men see the most dramatic improvements. Your circulatory system is incredibly sophisticated. It includes not just your heart and major blood vessels, but also tiny capillaries that deliver nutrients to individual cells.
As we age, several things can compromise circulation. Blood vessels can become less flexible due to inflammation and oxidative stress. The smooth muscle in vessel walls may not contract and relax as efficiently. And lifestyle factors like prolonged sitting, poor diet, and chronic stress can make these problems worse. But here's where it gets interesting. Circulation responds remarkably well to targeted interventions. Research shows that specific types of exercise, certain nutrients, stress management techniques, and even temperature therapy can significantly improve blood flow. One of the most overlooked aspects of male health is the relationship between circulation and hormone function. Many men don't realize that poor circulation can actually impair testosterone production and utilization. Your Leydig cells, the cells that produce testosterone, need good blood flow to function optimally. Similarly, circulation affects nervous system function. Your nerves need adequate blood supply to transmit signals effectively. When circulation is compromised, you might notice changes in sensation, coordination, or reflexes that have nothing to do with nerve damage and everything to do with blood flow. This is why addressing circulation often has cascading positive effects throughout the body. Men who improve their circulation frequently report not just better physical function, but improved energy, mood, and mental clarity as well. Now, let's get into the practical strategies that can help restore and maintain your vitality. I'm going to focus on approaches that have solid scientific backing and that I've seen work consistently in my practice. Strategy 1: targeted movement and exercise. Not all exercise is created equal when it comes to male vitality after 60. While any movement is better than none, certain types of exercise are particularly beneficial. Resistance training is absolutely crucial. Studies show that men who engage in regular strength training maintain higher testosterone levels, better bone density, and superior functional capacity compared to their sedentary peers. You don't need to become a bodybuilder. Even 2 sessions per week can make a significant difference. High-intensity interval training, when done safely and appropriately, can improve cardiovascular function and hormone production more effectively than steady-state cardio alone. The key is working with a qualified trainer who understands the needs of mature men. But here's something many men overlook. Pelvic floor exercises aren't just for women. Your pelvic floor muscles play a crucial role in core stability, bladder control, and sexual function. Simple exercises like Kegels, when done correctly, can provide significant benefits. Strategy 3: nutritional optimization. Your nutritional needs change as you age, and many men are unknowingly creating deficiencies that impact their vitality. Key areas to focus on include protein intake. Often needs to increase with age to combat muscle loss. Most men over 60 should aim for at least 1.2 grams of protein per kilogram of body weight daily, preferably from high-quality sources. Micronutrient status becomes increasingly important. Vitamin D, B vitamins, magnesium, and zinc are particularly crucial for male health. Many men are deficient without realizing it. Anti-inflammatory foods should make up the majority of your diet. Chronic inflammation is a major driver of age-related decline, and dietary choices can either fuel or fight this inflammation. Strategy 4: sleep and recovery optimization. This might be the most undervalued aspect of male health. During deep sleep, your body produces most of its testosterone and growth hormone. Poor sleep quality can devastate these crucial hormones. Creating an optimal sleep environment, maintaining consistent sleep-wake cycles, and addressing sleep disorders like sleep apnea can have profound effects on how you feel and function during the day. Strategy 5. Stress management and mental health. Chronic stress is a vitality killer. It disrupts hormone production, increases inflammation, and can create a cascade of negative health effects. But the good news is that effective stress management techniques can often reverse these effects. Regular meditation, deep breathing exercises, time in nature, and maintaining strong social connections all contribute to better stress resilience and improved overall health. Now, here's something I want to emphasize strongly. While lifestyle interventions are powerful, they work best when combined with proper medical care. Many men try to tough it out on their own, but this approach often leads to frustration and suboptimal results. A comprehensive approach to male health after 60 should include regular checkups with healthcare providers who understand men's health. This includes monitoring hormone levels, cardiovascular health, prostate health, and other key markers. Sometimes, despite our best lifestyle efforts, we need additional support. Hormone replacement therapy, when appropriate and properly monitored, can be life-changing for some men. Medications for cardiovascular health, supplements to address specific deficiencies, or treatments for underlying conditions might be necessary. The key is working with healthcare providers who take a comprehensive, individualized approach rather than just treating symptoms in isolation. I also want to address something important. There's no shame in seeking help. Too many men suffer in silence because they think asking for help is a sign of weakness. The truth is, taking proactive steps to maintain your health and vitality is one of the strongest things you can do.
Let me give you realistic expectations about what you can achieve and how long it takes to see results. This isn't about overnight transformations. It's about sustainable, long-term improvements. In the first 2 to 4 weeks of implementing these strategies, most men notice improvements in energy and sleep quality. These are often the first signs that your body is responding positively to the changes you're making. By 6 to 8 weeks, you might start noticing improvements in strength and endurance, especially if you've been consistent with exercise. Your mood and mental clarity often improve during this time frame as well. The 3 to 6 month mark is when many men see more significant changes in body composition, with increased muscle mass and reduced body fat. Hormone levels, if they were suboptimal, often show improvement by this point with proper interventions. Beyond 6 months, the benefits tend to compound. Men who stick with comprehensive health approaches often report feeling better at 65 than they did at 55, simply because they're now giving their bodies what they need to thrive. Remember, everyone's journey is different. Some men see rapid improvements while others need more time. The key is consistency and patience with the process. I want to leave you with this empowering truth. You have far more control over how you age than you might believe. While we can't stop the passage of time, we can absolutely influence how we experience it. The men I see who are thriving in their later decades share certain characteristics. They're proactive about their health, they're willing to make necessary changes, and they don't accept decline as inevitable. They understand that investing in their health is investing in their quality of life. Your body is remarkably resilient and responsive, even after decades of less than optimal treatment. It's never too late to start treating yourself better and seeing improvements as a result. But remember, this isn't about perfection. It's about progress. Small, consistent changes compound over time to create significant improvements in how you feel and function. If you're feeling overwhelmed by all this information, start small. Pick one area.
Maybe improving your sleep or adding some resistance training to your routine. Master that, then build from there. And please don't try to do this alone. Whether it's working with healthcare providers, joining a fitness program designed for mature men, or simply talking openly with friends and family about your health goals, having support makes a tremendous difference. If this information has been helpful to you, please give this video a like and share it with other men who might benefit from hearing this message. Your support helps us reach more men with evidence-based health information. I'd love to hear from you in the comments. What resonates most with you from today's discussion? What questions do you have about implementing these strategies? Your engagement helps me create content that truly serves your needs. And if you haven't already, make sure to subscribe to this channel and hit the notification bell. We're committed to providing you with the most current, science-based information to help you live your healthiest, most vital life at any age. Remember, you deserve to feel strong, energetic, and confident regardless of your age. Here's to your health and vitality.